Taiwan, a dynamic island, experienced robust economic growth during the past decades. By 1997, the per capita national income had already exceeded 12,000 US dollars. The health of the citizen is necessary for the nation's social and economic progress. Therefore, providing health care for Taiwan's population of 21 million has become a fundamental government policy. Before the National Health Insurance Program started, families without health insurance suffered with huge medical bills. Prior to the implementation of the National Health Insurance in 1995, about 60% of the population received health coverage from social insurance. In other words, 40% of the population had no health insurance protection at all. After 7 years of planning, National Health Insurance was officially launched on March 1st, 1995.
It is a major social development to implement a program as large as National Health Insurance. It provides comprehensive medical services that enable citizens to get rid of the fear of financial burden when sick and enjoy the right to equal access to high-quality health care.
Life is precious and fragile. The Bureau of National Health Insurance is like a mother who wishes that all of her children can be taken good care of. No matter whether poor, disabled, or sick, the mother's love spreads equally to her children. Participation in the National Health Insurance Program is mandatory for all citizens. Coverage includes all nationals as well as foreigners legally working in Taiwan. Presently, about 20 million people are enrolled in NHI, and the coverage rate has reached 96%. Premiums are assessed in proportion to ability to pay, as determined on the basis of the insured's salary. Their payment is shared or subsidized in varying proportions by the insured, the employer, and the government. The National Health Insurance is comprehensive and provides appropriate medical coverage to the insured, including physician service, hospital care, dental care, child delivery, rehabilitation, preventative health, home health care, Chinese medicine, pharmaceutical products, lab examinations, and daycare for the mentally ill. There is no advance appointment or doctor's referral required for visiting a doctor's office. When visiting a contracted hospital or clinic, the NHI beneficiary is required to pay 6 to 10% of the medical costs. To ease the financial burden on the insured, there is a ceiling for hospitalization, co-payment, and in some cases, such as catastrophic illness or injury, the co-payment is not required. The Department of Health is a regulatory authority for national health insurance. The Bureau of NHI headquarters in Taipei oversees overall operations, and 6 branch bureaus around the island handle local operations, such as enrollment, claims processing, premium collection, etc., in their respective jurisdictional areas. Sources of finance come from premiums collected from the government, the employer, and the employee. NHI is financed by the premium. 68% of health insurance expenditures are spent in outpatient services and 32% are spent in inpatient services. So far, the finances of the NHI are in balance, but the medical expenses are growing at higher rate than the premium revenue. In Taiwan, 97% of the hospitals and clinics are in the private sector. Notably, commercial health insurance barely exists. The Bureau of National Health Insurance has signed contracts with more than 94% of the hospitals and clinics nationwide to provide medical care for the insured. The insured is free to choose any contracted medical institution for medical services. The National Health Insurance provides health care for all citizens. Public satisfaction surveys show a continuous rise in the percentage of satisfaction for the first 2 years. It has now reached above 75%.
Looking prospectively, the society's demand for higher quality care will increase due to factors such as aging, advancement in medical technology, high education level, etc. In consideration of future developments in the healthcare industry, the quality of medical services, and affordability of the insured, the Bureau of National Health Insurance will expand case payment service items and implement global budget in dental care on a pilot basis. Moreover, to increase financial efficiency, the National Health Insurance will reform toward a multi-payment system in order to provide the most desirable health insurance system for our citizens.
And through the protection of NHI, the smiles of a day gone by have returned. And more importantly, a bright and happy future is guaranteed. National Health Insurance creates a chance for everyone to rise up together hand in hand and help each other. The contribution of one individual promotes society's progress. Hope comes from health. The National Health Insurance cares for your health.